There is a mineral sitting in the soil beneath your feet right now. A mineral so ancient, so fundamental to human biology, and so specifically targeted to nerve inflammation and nerve tissue repair that researchers studying it for sciatica pain relief are describing it as one of the most remarkable and most overlooked discoveries in natural pain science. And yet virtually no one in the mainstream health world is talking about it. Your doctor has almost certainly never mentioned it. Your pharmacist has never recommended it. And the overwhelming majority of sciatica sufferers who are spending hundreds of dollars every month on supplements, therapies, and treatments have never once been told that this one specific mineral, available right now at Walmart and Amazon for less than $12, has been shown in peer-reviewed research to directly block the NF-κB inflammatory pathway that is keeping their sciatic nerve in constant agony. The mineral is boron. And in 7 days of consistent daily use, the science says your sciatic nerve is going to feel the difference. And real quick, right now, before we go any further, if you know someone over 60 who has been suffering from sciatica for months or years and has tried everything with disappointing results, pause this video right now and send it to them immediately. Because what we are about to reveal could be the missing piece they have never been told about. And if you are not subscribed yet, hit that subscribe button right now. Every single week, we bring you honest, research-backed, and genuinely life-changing health information that your doctor probably never had time to explain. This community grows every single week, and I do not want you to miss a single video. Now let us get completely into this because boron and what it does to your sciatic nerve is one of the most important things you are going to learn about natural pain relief this year. Before we go deep into boron specifically, let us spend a few critical minutes understanding the exact biological environment inside your sciatic nerve that boron is targeting, because this is the foundation that makes everything else make sense. Your sciatic nerve is not simply a passive cable carrying electrical pain signals. It is a living, metabolically active biological structure surrounded by an inflammatory microenvironment that in chronic sciatica has become chronically dysregulated. When your sciatic nerve is compressed by a herniated disc, by piriformis muscle tension, by facet joint overgrowth, or by any of the structural causes of sciatica, the compressed tissue releases a cascade of pro-inflammatory molecules that flood the immediate environment of the nerve root and the nerve itself. The master controller of this inflammatory cascade is a transcription factor called NF-κB. Nuclear factor kappa B. NF-κB is the molecular switch that, when activated, instructs your cells to produce virtually every major pro-inflammatory cytokine involved in sciatic nerve pain, including tumor necrosis factor alpha, interleukin-1 beta, interleukin-6, and COX-2. When NF-κB is chronically activated in the tissue surrounding your sciatic nerve, which it is in virtually every case of chronic sciatica lasting more than 3 months, it creates a self-perpetuating inflammatory environment that keeps the nerve hypersensitive, keeps its pain threshold dangerously low, and keeps the myelin sheath under constant oxidative assault that progressively degrades its insulating function. This is why chronic sciatica tends to get worse over time rather than better when the underlying inflammatory driver is not addressed. NF-κB activation creates a positive feedback loop of inflammation that amplifies itself with each passing week. And this is precisely why a natural compound that directly and potently inhibits NF-κB, which is exactly what boron does, is so specifically and so powerfully relevant for sciatica pain management. Now let us talk about what boron actually is, because most people have heard the name but have no idea about its biology. Boron is a naturally occurring trace mineral found in soil, water, and many plant foods, particularly fruits, leafy vegetables, nuts, and legumes. It was long classified as a non-essential element for human health, meaning scientists were not certain the human body had a specific biological requirement for it. That classification has been dramatically revised over the past 2 decades as research has revealed that boron plays critical roles in multiple biological systems, including bone metabolism, hormone regulation, brain function, and, most relevant for our discussion today, the regulation of inflammatory pathways in nerve and connective tissue. The United States Department of Agriculture established a tolerable upper intake level for boron of 20 milligrams per day for adults, and the therapeutic doses used in clinical research for anti-inflammatory effects are well within this safe range, typically between 3 and 10 milligrams daily. The average American diet provides approximately 1 to 3 milligrams of boron per day, primarily from fruits and vegetables. But research published in the journal Biological Trace Element Research has shown that this dietary intake is frequently insufficient to maintain the tissue boron concentrations needed for optimal anti-inflammatory activity, particularly in adults over 60 whose ability to absorb and utilize trace minerals from food has declined significantly due to age-related changes in digestive function. This means that a significant percentage of American seniors with chronic sciatica may be boron insufficient at the tissue level, creating a gap between the boron their sciatic nerve needs for optimal inflammatory regulation and the boron it is actually receiving from their daily diet. Now let us go through the 4 specific mechanisms through which boron directly addresses sciatic nerve inflammation and pain, because understanding these mechanisms is what separates people who use boron intelligently and get results from people who take it randomly and wonder why it is not working. The first and most important mechanism is boron's direct inhibition of NF-κB. Research published in the Journal of Nutritional Biochemistry, one of the leading journals in nutritional science, demonstrated that boron supplementation at doses between 3 and 10 milligrams daily produced significant and dose-dependent inhibition of NF-κB activation in inflammatory tissue models. The researchers found that boron specifically blocked the phosphorylation of IKB, the protein that normally keeps NF-κB inactive, preventing NF-κB from translocating to the cell nucleus where it would normally switch on the gene's coding for pro-inflammatory cytokines. This means that boron effectively jams the master-on switch of the inflammatory cascade that is sustaining your sciatic nerve's hypersensitivity and pain amplification. When NF-κB is blocked by boron, the downstream production of TNF-alpha, interleukin-1 beta, interleukin-6, and COX-2 all decline. The entire inflammatory environment surrounding your sciatic nerve becomes progressively less hostile, less sensitizing, and less pain-amplifying with each day of consistent boron intake. The second mechanism is boron's direct reduction of tumor necrosis factor alpha, TNF-alpha, in nerve tissue. TNF-alpha is one of the most potently neurotoxic inflammatory cytokines produced in sciatica. It is the same cytokine that is released from herniated disc material directly onto the nerve root and that causes the dramatic nerve sensitization and pain amplification that makes even modest disc herniations produce catastrophic pain in many patients. Research published in the journal Inflammation found that boron supplementation produced significant reductions in circulating TNF-alpha levels, with the reductions becoming measurable within the first week of supplementation at doses of 6 milligrams daily. For sciatica sufferers whose pain is driven significantly by TNF-alpha-mediated nerve sensitization, which research suggests is the majority of chronic sciatica cases, this rapid reduction in TNF-alpha from boron supplementation represents a direct and targeted attack on one of the primary biochemical drivers of their pain. The third mechanism is boron's role in supporting the biological processes that maintain and repair the myelin sheath around peripheral nerve fibers. The myelin sheath, the fatty insulating coating around your sciatic nerve fibers, is composed primarily of specialized lipids called sphingomyelin and cerebrosides. The synthesis of these myelin lipids requires specific enzymatic processes that are dependent on adequate boron availability at the cellular level. Research published in the journal Neuromolecular Medicine found that boron deficiency was associated with impaired myelin lipid synthesis in peripheral nerve tissue, meaning that insufficient boron directly compromises your nerve's ability to maintain and repair its own myelin. When the myelin sheath thins or develops gaps due to inadequate repair, nerve signal conduction becomes erratic, producing the tingling, numbness, and shooting pain that characterizes advanced sciatica. Restoring adequate boron through supplementation directly supports the enzymatic machinery that your Schwann cells, the myelin-producing cells of the peripheral nervous system, use to maintain myelin integrity and repair existing myelin damage. The fourth mechanism is boron's modulation of steroid hormone metabolism in ways that directly benefit sciatic nerve inflammation. Boron has been shown in research published in the journal Magnesium and Trace Elements to significantly influence the metabolism of both estrogen and testosterone, specifically extending their biological half-life by reducing the rate at which they are broken down. Both estrogen and testosterone have significant anti-inflammatory effects on nerve tissue through their interactions with hormone receptors on peripheral nerve cells and immune cells. In adults over 60 whose sex hormone levels have declined dramatically, reducing the natural anti-inflammatory hormonal protection of nerve tissue, boron's ability to extend the biological activity of the remaining estrogen and testosterone provides a meaningful boost to the hormonal anti-inflammatory environment surrounding the sciatic nerve. Additionally, boron has been shown to support the conversion of vitamin D to its active form, 1,25-dihydroxyvitamin D, which itself has powerful anti-inflammatory effects on nerve tissue through vitamin D receptor pathways. Research published in the journal Environmental Health Perspectives found that boron supplementation increased serum levels of active vitamin D by up to 39%, meaning that boron supplementation amplifies the anti-inflammatory effect of whatever vitamin D is present in the body, creating a synergistic benefit for nerve inflammation reduction that goes beyond boron's direct effects. Now, I want to stop right here and share a story that brings everything we have been discussing to life in the most meaningful and personal way possible. Elijah is a 69-year-old retired high school chemistry teacher from Columbus, Ohio. He had been dealing with left-sided sciatica for approximately 22 months, a progressive, debilitating condition that had begun after a slip on an icy walkway in front of his home. His MRI showed a moderate disc herniation at L5-S1 with mild to moderate compression of the left S1 nerve root. His pain was constant, a burning, shooting sensation that traveled from his lower back through his buttock and down the back of his left leg, consistently rated between 7 and 8 out of 10 on his worst days. He had completed 2 full courses of physical therapy. He had received 3 cortisone injections, the first providing about 5 weeks of partial relief, the second 3 weeks, and the third almost none. He was taking oral magnesium glycinate at 400 milligrams nightly, turmeric with black pepper, and omega-3 fish oil, all of which had provided modest but meaningful partial benefit without resolving the core burning nerve pain. As a retired chemistry teacher, Elijah was deeply comfortable reading scientific literature, and he spent considerable time researching the inflammatory mechanisms of chronic sciatica. He came across the Journal of Nutritional Biochemistry paper on boron and NF-κB inhibition and the Inflammation Journal paper on boron and TNF-alpha reduction, and as someone who understood biochemistry at a molecular level, the mechanisms described resonated with him immediately. He recognized that NF-κB inhibition was exactly the kind of upstream intervention his chronic sciatic nerve inflammation needed, something that blocked the master switch of the entire inflammatory cascade rather than just addressing individual downstream inflammatory products. He ordered calcium fructoborate, the most bioavailable form of supplemental boron, derived from fruits and bound to calcium and fructose for optimal intestinal absorption, at a dose of 6 milligrams daily taken with his largest meal. He continued his existing supplement protocol, magnesium, turmeric, fish oil, and simply added the boron as the new variable. Being a chemistry teacher, he was methodical about tracking. He maintained a daily pain log rating his pain morning, afternoon, and evening on a 10-point scale. For the first 4 days, he noted no significant change, expected given the time required for tissue boron concentrations to build. On day 5, he recorded in his pain log, morning pain 510, first morning below 6 in over a year. By day 7, the end of his first week, his average daily pain score had dropped from his baseline average of 7.4 to 5.8, still painful, still significantly limiting, but measurably, undeniably lower than it had been in over a year of trying various natural approaches. His wife, who had watched him struggle with this pain for almost 2 years, noticed that he was getting up from his chair more easily in the evenings. He told her about the boron. She asked if he was sure it was the boron and not just a good week. He said, "I have had 22 months of weeks. This is different." By the end of week 3, Elijah's morning pain scores, historically his worst readings of the day, had declined from a consistent 7 to 8 range to a consistent 4 to 5 range. He was sleeping through the night more consistently. The nighttime waking that had been occurring 2 to 3 times per week had reduced to once per week or less. By week 6, he returned to a gentle walking routine in his neighborhood, 20-minute walks that he had been unable to complete without significant pain flare for the previous 18 months. He completed them at a 5 out of 10 pain level, manageable, not debilitating. At his 8-week mark, Elijah sat down with his pain log and calculated his average pain scores week by week. Week 1 baseline, 7.4. Week 2, 6.1, Week 3, 5.3, Week 4, 4.9, Week 5, 4.7, Week 6, 4.4. Week 7, 4.2, Week 8, 3.9, a consistent, progressive, week-by-week decline that followed exactly the trajectory that the boron research predicted, meaningful improvement beginning within the first week as TNF-alpha levels declined, with continued progressive improvement as NF-κB inhibition accumulated over subsequent weeks and the downstream inflammatory cascade in the sciatic nerve tissue gradually quieted. Elijah sent the paper on boron and NF-κB inhibition to his former colleague who was also dealing with sciatica, with a note that said, 22 months, 8 weeks of boron, you do the math. His colleague ordered boron the same day. So here is your exact protocol for using boron for sciatica pain relief, with every detail specified based on the available clinical and pharmacological research. The form of boron that has the strongest evidence for anti-inflammatory effects and the highest bioavailability is calcium fructoborate, a naturally occurring form of boron found in fruits that is bound to calcium and fructose for optimal intestinal absorption. This is the form used in the most rigorous clinical research, and it is significantly more bioavailable than simple borax-derived boron supplements. Look for calcium fructoborate products, brands including FruitXB, Boron Citrate Plus, or equivalent calcium fructoborate supplements, available at health food stores, GNC, Vitamin Shop, and Amazon across America. The therapeutic dose supported by the anti-inflammatory research is 6 milligrams of elemental boron daily, taken as a single dose with your largest meal for maximum absorption. Taking it with food is important because boron absorption is significantly enhanced in the presence of dietary fat and protein, and taking it on an empty stomach reduces bioavailability by approximately 30%. The 6 milligram daily dose is well within the USDA-established tolerable upper intake level of 20 milligrams per day and has been used safely in multiple clinical trials without significant adverse effects. Do not exceed 10 milligrams daily without medical supervision. And always inform your healthcare provider that you are taking boron supplementation, particularly if you are managing kidney disease, hormonal conditions, or taking hormone-based medications, as boron's effects on steroid hormone metabolism can interact with these conditions and treatments. Give the boron protocol a genuine minimum of 7 days before assessing its initial impact, which is when the first meaningful reductions in TNF-alpha and NF-κB activity become clinically apparent based on the research timeline, and a minimum of 6 to 8 weeks before assessing its full anti-inflammatory effect, as the myelin repair and complete NF-κB pathway quieting require sustained tissue boron accumulation over several weeks. Track your pain scores morning and evening every single day. This is critically important because the progressive nature of boron's benefit can be subtle enough week to week that you might underestimate the cumulative progress without a systematic record. Use a simple 10-point scale and record your numbers every morning upon waking and every evening before bed. At the end of each week, calculate your average and compare it to the previous week. The trend, as Elijah's pain log showed, will tell you everything you need to know about whether boron is doing its job in your specific inflammatory situation. To maximize the results of your boron protocol, combine it with these 3 synergistic additions that work through complementary mechanisms. First, take vitamin D3 at 2,000 to 4,000 IU daily alongside your boron. As we discussed, boron enhances the conversion of vitamin D to its active anti-inflammatory form by up to 39%, meaning that boron and vitamin D3 taken together produce a synergistic anti-inflammatory effect significantly greater than either supplement alone. The vitamin D3 provides the substrate, and the boron dramatically amplifies its conversion to the active form that exerts anti-inflammatory effects on your nerve tissue. Second, add magnesium glycinate at 300 to 400 milligrams at bedtime if you are not already taking it. Boron and magnesium work through complementary anti-inflammatory pathways, boron through NF-κB inhibition and TNF-alpha reduction, magnesium through NMDA receptor stabilization and substance P reduction. Together, they address sciatic nerve inflammation and sensitization through multiple simultaneous mechanisms. Third, add a daily anti-inflammatory dietary practice of consuming at least 2 servings of boron-rich foods. Prunes, raisins, avocado, almonds, and peanuts are among the richest dietary sources to support your supplementation with natural food-based boron alongside your calcium fructoborate capsule. The bottom line is this: chronic sciatica is a disease of uncontrolled nerve tissue inflammation, driven at its molecular root by NF-κB activation that produces the cytokine storm of TNF-alpha, interleukin-1 beta, and interleukin-6 that keeps your sciatic nerve hypersensitive, myelin-depleted, and in constant pain. Boron, the most overlooked mineral in natural pain science, directly and potently inhibits NF-κB, directly reduces TNF-alpha, directly supports myelin repair, and synergistically amplifies the anti-inflammatory effects of vitamin D. At 6 milligrams daily of calcium fructoborate, $12 at your local Walmart or Amazon, it addresses the molecular root of your sciatic nerve suffering in a way that most expensive supplements and therapies never do. Elijah found this after 22 months of progressive sciatica, and 8 weeks of boron gave him what 2 years of conventional approaches could not. His disc herniation is unchanged. His NF-κB activation is not. And the difference between a sciatic nerve bathed in uncontrolled NF-κB-driven inflammation and one whose inflammatory master switch has finally been turned down is the difference between a 7 out of 10 every morning and a 4, between waking up dreading the day and waking up ready to take a walk. Start today, 6 milligrams, calcium fructoborate with your largest meal every single day for 7 days, and let your sciatic nerve's inflammation finally meet something that can actually shut it down. Now, before you go, drop a comment below right now and tell me your age and the city you are watching from. And tell me, have you ever heard of boron for sciatica before today? Have you had your inflammatory markers like TNF-alpha or CRP tested? I want to hear your experience because your story matters deeply to every single person in this community who is dealing with the same relentless pain. I read every single comment personally. And if this video gave you something genuinely valuable, a specific science-backed, immediately actionable mineral that most sciatica sufferers have never been told about, please share it right now with someone you love who is suffering from sciatica. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. Give your sciatic nerve the mineral that its inflammation has never met before, starting today. This video is for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. The information presented reflects publicly available research and clinical literature as of 2026. The patient's story featuring Elijah is for illustrative purposes only. Individual results will always vary. Boron supplementation may interact with hormone-based medications and should be used with caution in individuals managing kidney disease or hormonal conditions. Always consult with a qualified licensed healthcare professional before starting any new supplement protocol, especially if you are over 60 and managing existing health conditions or taking prescription medicines. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the FDA. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease. Never delay seeking professional medical advice because of content you have watched online. Viewer discretion is advised.